Occipital nerve block. Introduction. An occipital nerve block may be used to diagnose the cause of pain in which of the following areas? Choose one of the following options. 1. Near the ear. 2. Neck. 3. Scalp. 4. All of the above. Correct. An occipital nerve block may be used to diagnose the cause of pain near the ear, in the neck, or in the scalp. Before the procedure, do you need to tell your healthcare provider about any vitamin supplements you are currently taking? Select yes or no. Correct. You need to tell your healthcare provider about all of the medications you are currently taking, including vitamin supplements. Certain medications may need to be stopped before the procedure. Do infections and allergic reactions often happen after an occipital nerve block? Select yes or no. Correct. Infections and allergic reactions are rare, but they may still happen. Noah had an occipital nerve block. To best heal, he should choose one of the following options. 1. Avoid taking a shower or a bath. 2. Rest for a few days. 3. Use an ice pack to reduce swelling or soreness. 4. All of the above. Correct. If you had an occipital nerve block, do activities you can tolerate, but rest more than you usually do. You may feel sore. Thank you for using Explain.